Hi everyone, hope you're doing well and everything is fine with you. So the purpose of this video is to basically tell all the candidates who have finished the ADC exams or who are in the process of the ADC exams or who are about to start the ADC process for them to know what happens after ADC or what after ADC, all right? So that's something that keeps a lot of candidates confused on what should we be doing once we are done with the ADC exams, both the written as well as the practical exam, all right? So this video is going to guide you in regards to that. And our main focus of discussion would be the APRA registration, the visas options available, the jobs, the salary, and the living standards in Australia. All right. Now, please remember that whatever I discuss in this video in regards to numbers and ratios and percentages, it's all average. Okay. It's based on my personal experience, experience of hundreds of candidates, experience of a lot of dentists, practice owners that I know of. Okay, so don't take everything that is in this video as an exact figure because there can be slight variation towards the upward as well as a downward trend. All right. So yeah, so we'll discuss five main aspects of what happens after you are done with the ADC exams and what process, what steps are involved after the ADC exams are done and you receive the ADC certificate from the Australian Dental Council. So what happens after that? All right. So we're going to discuss them and I'll go through a lot of things, a lot of topics, a lot of information that's going to be tremendously valuable for anyone who's starting the journey, in the process of the journey, or who have completed the ADC journey. Okay, so we'll get started. Okay, before that, of course, who you are listening to. My name is Dr. 𝗬𝗲𝗿𝗀, and I'm ADC certified APRA registered dentist, working currently in 3 practices in Australia, have a lot of experience teaching the ADC candidates. The Academy had a lot of success stories, both with the written as well as the practical exam, and still continue to grow. All right. So let's get back to the purpose of the video, which is the focus of discussion. Like I said, APRA registration, visas, jobs, salary, and living standards in Australia. Okay. So let's get started with the APRA registration. Now, once you're done with ADC, you will receive the ADC certificate, the completion certificate from Australian Dental Council, right? From that onwards, your links with ADC are cut off. All right. You don't need ADC anymore in your life as such. Okay. You have already done enough. You have dedicated enough time. You have gone through all the hassle, the trouble, the stress with ADC. Now it's time to say goodbye to ADC. All right. Now it comes the APRA, which is the Australian Health Practitioner Regulation Agency. All right. Because that's the first step that you need to do is do the registration with APRA to become a registered dental practitioner in Australia. Okay. So how that happens is that, of course, it's all online these days. Okay. Pretty simple, pretty straightforward. When we did the exam, we had to go through the paper-based system, but now it's all online. You submit the application form, fill the form and submit it. You'll need certain documents for that, a criminal check as well, police certificates, the country where you're currently practicing, registration certificates from them. And then, of course, you will need an English test because you don't need an English test for ADC, but you do need an English test when you're getting registered with APRA. It can be either IELTS, it can be either a PTE, it can be TOEFL. So there are multiple options that the APRA gave you for you to be completing this English test. All right. It's a simple, easy, and a straightforward process. Once APRA registration is complete, you are registered in Australia to work as a dentist. Okay. So APRA registration, once it is done, you get into their register of practitioners, your name is there, you are allowed to work as a dentist in Australia, even if you are not in Australia. Of course, because a lot of overseas candidates, once they finish the ADC exams, they are not in Australia, right? They are going to be outside Australia and starting the APRA process. So once you submit the documents to APRA, they will take roughly around 2 to 3 months to assess your documents. Everything is in place. And once you receive the outcome of the application, you will be registered with APRA. Okay. And most of the time, by that time, you are still going to be outside Australia for overseas students, of course. For who are in Australia, that's a different story. But for candidates who are outside Australia, once you're done with your registration, there is a good possibility that you will not be still in Australia because you have to sort out your visas and all that stuff. Okay. So APRA, the first step, pretty simple, pretty straightforward, nothing complex, a few documents that they need, an English test that they need. Once you submit, they assess your documents. And once you're registered, it basically means that you are allowed to practice as a dentist in Australia. Uh, it happens every year, even if you're registered, like for us, for me, we have to renew it every year as well. So it's basically like a registration that you need to review every 12 months. All right. So you have to do the renewal. But that's not something that you need to be concerned. The first step is getting registered with APRA. Once you are done with the APRA registration, then comes the main and the most important point, the visas options, right? So if you are already in Australia on any long-term visa, start searching for jobs and will be able to work very soon after APRA registration. Now, of course, it's going to be different for candidates who have cleared ADC, who have registered themselves with APRA and who are currently in Australia, because for them, they don't need to bother about the visa process because they already have a visa to legally stay in Australia, right? So they don't need to bother. Once they get registered with APRA, they can start working straight away. They start looking for jobs. And because most of these students who are in Australia already, they are working as a DA, as practice managers in different clinics. So they can get even started at the same clinic that they work as a DA, which happens quite often, and then they start working as a dentist in the same clinic. So that's a different story for candidates who are already in Australia, okay? Because for them, the only thing is clear ADC, get registered with APRA, and probably in a few weeks or months' time, you get started working as a dentist. You don't need to bother about visas and stuff like that. But for candidates who are outside Australia and need a visa to come to Australia, which is basically the majority of the pool taking the ADC exams, right? Because majority of them are not currently in Australia. They might be either in India, they might be in Pakistan, Gulf countries, European countries, or any part of the world. They have to move to Australia on a visa that allows them to stay in Australia legally, right? Now, what options do candidates who are outside Australia have to move to Australia to work as a dentist? Okay. Now, let's see from this section on the Department of Home Affairs. Okay. These are the visas available to dentists according to the Department of Home Affairs and the immigration website. Okay. So you basically have 6 options of visa, which, to tell you very frankly, has increased from what it used to be when we cleared the ADC exam. It's a bit different now, and candidates have more opportunity to move to Australia and start working here. All right. The reason why they did this, they increased the chances for the dentist to move to Australia easily, is because there is a huge shortage of dentists. The population is increasing, the patient demands are increasing, the number of practices are increasing. So automatically, all this leads to a greater requirement of dentists to work in Australia. Okay. Now, the visas that you have once you clear the ADC, you can see there are 6 options, but I have eliminated the first 2 options. You can just see this blue highlight for the next 4 visas. The first 2 options, of course, you don't need to worry about them because that's not something that you will be eligible for. The next four visas is something that an overseas dentist who is outside Australia can be eligible for. All right. Let's go through each one of it. Skilled employer sponsored regional provisional subclass 494 employer sponsored stream. What this visa basically means, that's once you are starting to search for jobs, you might find certain employers willing to sponsor you to move to Australia. That's why it's called an employer sponsored stream. So the employer sponsors you, and based on that sponsorship, you are able to come to Australia and work as a dentist. All right. Now, please remember it says regional. Okay. Now, what does that mean? Any place in Australia except Melbourne, Sydney, and Brisbane, that's regional. Okay. So on this visa, except Melbourne, Sydney, and Brisbane, you can work anywhere in Australia. Okay, so that's why it's basically a skilled employer sponsored regional visa, which is the employer sponsored stream. Okay, so you can work on this visa anywhere in Australia except Melbourne, Sydney, and Brisbane. All right, because they are not considered regional. Then you have the option of 491, skilled work regional subclass 491, state or tertiary nominated. Now, what does this mean? Now, this is a type of visa which the state basically sponsors you. You don't need an employer. You're not born to an employer. The state nominates you for this visa. Okay. Now, with this visa, of course, the time frame is quite lengthy. Why? Because first you go to the Department of Home Affairs website, registered your interest to move to that particular state, and that state nominates you. If your nomination is accepted, then only the process of 491 starts. So basically, the state has to nominate you, and the state nominates you based on your points, based on the requirements, based on the shortage of your particular occupation in that particular state. Okay. So it's a bit lengthy process, and the visa processing time for 491 is usually much, much greater, which by what I mean is roughly around probably 12 months to 18 months or even 24 months. So that's something that's quite lengthy processing time. Okay. With 494, the processing time is usually short because it's not the state that is nominating you, it's the employer that is nominating you. So probably around 5 to 6 months or probably at 8 months time. Okay. Now with 494, you will be able to stay in Australia for, I believe, 3 to 4 years. Okay. And then it converts to PR. With 491, again, you'll be able to stay, I believe, for 4 to 5 years, and then it converts to PR. All right. So both these visas automatically converts to PR later on with options available. Okay. But of course, first you need to spend the required time, that is the requirement of these visas, to be in Australia before you can consider the next step, which is the PR. 482 skills in demand, subclass 482 core skills stream. Okay. Now, what does this mean? Again, this is an employer sponsored stream visa, which means you'll have to find an employer who's willing to sponsor you to move to Australia. But one important thing over here is this visa is not a regional visa, which means you can have an employer in any part of Australia, including Melbourne, Sydney, Brisbane, and move to Australia and work in these particular respective countries or cities. All right. So 482 is not a regional visa. Amongst the options that you have, 482 skills in demand, which was actually introduced earlier this year, which is 2025. This is the most easiest and the quickest, frankly speaking, probably around 2 to 3 months maximum. And you get this visa. okay? Because it's a skills in demand, and dentists are in skills in demand, which means they are in shortage occupation, which is the core skill stream, okay? And they are able to come to Australia on a 482 skills in demand visa. The last option you have is 186 employer nomination scheme visa subclass 186 direct entry pathway. Now, frankly speaking, this is the best option because this is basically permanent residency. So once you get the 186 visa, you can stay in Australia indefinitely, but it's still an employer nomination visa, which means there will be an employer who's willing to sponsor you for you to be able to move to Australia and start working as a dentist. Okay. So this visa basically is a permanent residency, which means you can stay in Australia permanently. But there is a clause here. This visa takes a lot of time, probably around 1.5 to 2 years, or maybe even more, because the number of documents, the processing time for this visa is a lot. Okay. Now, for this visa, like I mentioned, 494 and 491, of course, once you get that visa, you stay in Australia for a particular time and then you convert it to PR. Now, what about 482? Now, for candidates who come to Australia or dentists who come to Australia on a 482 visa, they can convert the 482 after 2 years into a 186, which means basically allowed to stay in Australia indefinitely. So 482 and 186 are quite similar in that nature, which means they are not regional visa. You can work in any place of Australia. 482, initially, the processing time is quite short, which is around 2 to 3 months. You need an employer for that. Once they sponsor, you'll be able to move in to Australia and work for that particular employer. 186, again, the same thing, the same documents, the same category, which is the employer nomination. But of course, once you lodge the application for 186, it takes a bit longer, like really long, for you to get an outcome. Like I said, around 2 years or maybe even more. Maybe if you're lucky, probably in a year or so. But that's really unlikely. Okay. So it all depends on you which visa you would like to select. There are multiple options. Once you clear ADC, it's always a good idea to speak to a migration agent, all right? Although they will charge you a fee for that, but that's something you're going to benefit, right? Tell them the options available, tell them which visas are available to you, tell them about the employers, if there are employers who are willing to sponsor you. There are many employers in Australia who are willing to sponsor overseas dentists, many of them. So it all will depend on your situation at that time, right? If you come on a 482 visa, 2 years later, you can change it into a permanent residency, which means you can lodge an application for 186 and submit that, which will allow you to stay in Australia permanently. If you go with 186 straight away, of course, that is also applicable, but then you have a greater waiting time until you get an outcome of the visa for you to be able to move to Australia. Okay. Now, my opinion, if you take, I would say the 482 is the best one. Like, why? Because with 482, you come to Australia sooner, which means within the next 2 to 5 months, you can be in Australia, start working as a dentist. And while you are still working and staying in Australia, after 2 years, apply for 186 and stay in Australia permanently. So again, this is my personal point of view, which makes a bit more sense. But again, please talk to your immigration agent, your family circumstances, how soon you would like to be in Australia also matters, right? Because certain candidates, especially in Gulf countries in different parts of the world, they are working and they don't want to move to Australia so soon after clearing ADC and getting registered with Ahpra. They want to move like maybe after a year, after 6 months, after 2 years. So go according to your situation, all right? And please make sure that you visit the Department of Home Affairs, read in detail about all these visas. There is great deal of information on the Department of Home Affairs website regarding each visa. There is a great detail, the requirements, the documents required, what you can do with the visa, application time, processing time, application form. Everything is on the Department of Home Affairs. Okay. So yeah, so even if you're overseas, once you clear the ADC, please remember you have a lot of options to come to Australia. So don't worry. The only barrier or the only hassle that you need to get over with is ADC. After that, the journey is pretty smooth. Okay. And there are many employers who are willing to sponsor you. Okay. There are a lot of employers right now, even at the time of making this video, our practice are looking for dentists. We are in process of, you know, getting dentists from India and Kuwait at this moment because they cleared ADC and they want to move and join us. So you will get a lot of opportunities. There are many employers willing to sponsor. Okay. Let's go to the next section, jobs. All right. Like I said, many. There are many jobs for dentists in Australia. One major job board, which is seek.com, at the time of this video, there are over 1,600 dentist job listing across Australia at the time of this video. The dental recruitment sector says the Australian dental market is thriving and evolving, driven by increased patient demand because the population is increasing. A lot of people are moving to Australia. A lot of people are relocating, migrating to Australia. And according to the Australian Dental Association, population growth, aging population, and greater awareness of dental health all contribute to higher demand for dental services. Significant shortage of dental services in regional and rural areas of Australia. That means opportunity, especially outside major metros. So you will find always a greater deal of opportunities outside the main cities. And to tell you very frankly, you don't need to stay in main cities. They are crowded, traffic, and all that. And you will earn more if you're not in the city. Because dental checkups and preventive care are increasingly emphasized, there's ongoing need for qualified dentists. Now, this is actually very true. We do need a lot of dentists, but then ADC says, no, I'm not going to give you a lot of dentists. So they don't really pass a lot of candidates, unfortunately, based on how much the requirement is. But I think they want to keep the standard and just don't want a huge influx of dentists into Australia. And just my personal situation, I remember when I cleared ADC and got registered with Ahpra, so I made a profile on the seek.com and uploaded my CV. I got 7 jobs offer on the day. So when next day when I opened the seek.com, just thinking if there is a job for me or not. And then I saw 7 employers who were willing to sponsor me straight away. Of course, I did select at that time one of them based on my personal satisfaction and whatever I knew, because I know a lot of dentists here, a lot of practice managers, a lot of practice owners because of my teaching of ADC. That's the reason I knew so many people already while I was in the ADC journey. So once I got registered with Ahpra, I had many people already knowing me, and when they got to know that I want to move to Australia and start working from Dubai, I wanted to move to Australia. So, of course, because they already have quite a lot of information about me, they were willing to just, um, uh, help me come to Australia and start working as a dentist with them. So, yeah, it was quite rewarding, and that's going to be the same case with you guys as well. Once you get registered with APRA, you will see a lot of employers willing to help you to move to Australia and start working for them as a dentist. So don't worry about all the processes that happens after the ADC. It's pretty simple. Of course, you need some patience with the visas, the APRA registration, and all that. But eventually, it's not something that you won't be able to get it. There are many jobs. Coming on to the main part, which is the salary, right? Now, in regards to salary, first of all, please remember that it will depend on a lot of factors. Okay, that's why earlier in this video I said don't take these numbers as an exact because it is going to vary quite significantly based on your years of experience, what you can bring to the practice, what procedures are you comfortable in doing. For example, fillings, root canal treatments, tooth removals. If you add surgical removals to that, that's a great benefit. Crowns, veneers, partial dentures, Invisalign, and then add on implants. Now, let's say you don't do implants and you're capable of doing this. That's more than enough. You are going to earn a lot. And even if in the crowns and the veneers, I've underlined them because crowns and veneers is something that we do so often here. Each crown is roughly around 2000 Australian dollar. So imagine if you place a 3 unit bridge, let's say, that's 6,000 Australian dollar, right? That's pretty straightforward. Each veneer is roughly 1,250 Australian dollar. So even if you don't do implants and you just do these basic procedures, and to tell you very frankly, you should be well versed with it because you're a dentist, right? So this is not something that is extra that is someone is asking from you. If someone asks or expects you to perform these procedures, you should be able to do them, right? Even let's say, let's remove Invisalign. Even if you do all these fillings, root canal treatments, tooth removal, surgical, crowns, veneers, partial denture, that's going to be enough to make a lot of money every month and every year. Okay. But you need to be comfortable, competent enough to do that. Root canal treatments, not that I will only do root canal treatments for anterior teeth. Why? You should be capable of doing all root canal treatments, upper molars, lower molars, tooth removal. Of course, if you have the surgical tooth removal capability as well, that adds a lot to it because you see a lot of patients, especially old age patients whose oral health condition is deteriorated, and then the younger versions who have wisdom tooth removals. You will see a lot of them. I think last week itself I did 7 surgical extractions. I think 4 of them were wisdom, and the remaining were the others. So, and each surgical removal is roughly around 750 to 800 Australian dollar. So you see, it depends how much you can do, how much you can bring to the practice. That will be what you will be earning basically, right? If you say, no, I'll just restrict myself to fillings, cleanings, and probably simple tooth extraction, then of course you don't expect to earn more, right? You can't do that because every practice wants the dentist to do majority of the procedures. If you're capable of doing all the basic minimum procedures which I have mentioned, you are able to generate a lot of income for them and for yourself as well. If you add Invisalign, that's even greater because a lot of people here are cosmetically, aesthetically concerned. You will see a lot of patients wanting Invisalign treatments. If you do implants, add on, which is I mentioned implants, then it's an upward trajectory, all right? Because um, each implant will be 7,000 to 8,000 Australian dollar, all right? Because it includes everything, the surgical template, the insertion of the endo-osseous implant, the abutment, and then the crown on top of it. So all this, if you add, it gets to like 8,000 Australian dollar. So imagine if you do 2 to 3 or 4 implants in a week, or maybe let's say 5 implants in a month. Just imagine where your income would be, right? So the practice of dentistry is very healthy, very rewarding. Okay. But please make sure that you do know how to do these procedures. That's why a lot of employers they like people who are a bit experienced in doing this procedure rather than straight out of house job or straight after their college and they start ADC process. Even though that is fine because you'll get to learn all these things as you go along. So that doesn't make a difference. Initially, you'll start low, and then a few years later, you will start getting comfortable with all these procedures. So even if you're not experienced, that's not a major drawback. But of course, if you're experienced, maybe let's say 5 years, 10 years, your starting salary is going to be much greater compared to someone who's not experienced at all. Although the not experienced at all one will still earn good enough money, but if you're experienced, you have an edge because basically it depends on what procedures you are doing. So the experienced dentist is more comfortable in doing more procedures, right? Which means more income for the clinic or the practice and more income for you. The inexperienced dentist, although can do all the basic procedures, but they're not doing the complex ones, which means less income for the practice and less income for you. But again, that income is not bad. It's really good, which you can easily sustain yourself and live a comfortable life. Rural urban areas, again, this is also an important thing to consider on which will be your salary will depend on that. Because if you are in the rural areas, now please remember in Australia, rural and urban areas doesn't make much of a difference because you have all these basic life necessities, basic shopping malls, stores, everything in, even if you are in a rural area, because that's how the government works, that's how the government planning works. So the rural people earn a bit more. Why? There are a few reasons to that. Because in rural areas, you don't have as many dental clinics as you would have in urban areas, which means that you have more patients coming into your clinic compared to urban areas. Because in urban areas, the patient has more opportunity to select from different clinics, right? So maybe the number of patients coming to your practice might be a bit less compared to in a rural area. Okay. Corporate or private owner. Now, this also makes a difference if you are going to a corporate chain, which is like an HBF, a Mayone, and all these other Abano Healthcare, I believe, as well. So these are all corporate chains, right? Now, corporate chains, I would say is good for someone who's initially starting their journey as a dentist in Australia. But once you establish yourself, it's always good to work with private employer. I have felt that there is a greater tendency to earn much more within private employer because the corporate ones, I like it's still good. It's really good, and certain corporate ones do offer great packages, great salary packages. But that's just my opinion. I felt working with private employer makes life easy, work-life balance much more easier. But again, there are corporate practices which will give you a good salary packages, and if you're experienced, I don't think so that should make any difference. So that's totally your personal choice where you would like to work. It doesn't make a difference in Australia. It's not that you're born to one employer. If you're not happy, you can always leave. So even if you start with a corporate or private owner, doesn't make much difference. See what you are able to get initially after finishing your ADC and getting registered with Ahpra. See what options suit you, what options, because sometimes you might not get any offer from private employer. You are getting corporate employers um, sponsor able to sponsor you to move to Australia. So go with them. That's perfectly fine. Like I said, you can change employers as frequently as you want. In Australia, it's not like that. Like you could just bond to one employer for life. No, that's not how it works. And also, it depends on the days of working, right? Because you will see dentists working 4 days a week, 5 days a week, and sometimes 6 days a week as well. So, of course, as common sense would prevail, the more days you work, the more income you generate, right? But of course, you have to see your work-life balance, your family commitments, and all that, and then decide how many days you would like to work. Regardless, let's say, which means regardless of all these factors, the salary will be quite good to live a comfortable life. I've given a range here, uh, 150,000 to 400,000 Australian dollar per annum before tax. All right. So this is basically a range that you can expect as a starting dentist, and as you get and set your foot in Australia and become a solid dentist with years of experience, your salary will tremendously increase, right? Now let's say remove tax, which means take home pay, the amount that goes into your pocket for you, all right, after tax, which means once you remove tax, so what amount of money you will be taking home, or what amount of money will be hitting your bank account. So I've given three limits here, which is 120,000 Australian dollar per annum or 10,000 AUD per month. So this is after tax. This is the money that is only yours once the tax has been deducted. Or 180,000 Australian dollar or 15,000 AUD per month. This is the mid limit. Okay. This is the lower mid limit. And then 240,000 Australian dollars per annum or 20,000 AUD per month. This is the above mid limit, right? So these are just rough ranges based on my experience with so many employers, so many dentists working in different practices. Uh, so this is something that you can expect as a low, initially probably as a lower mid limit once you start setting your foot into Australia, then going to the mid limit and then above mid limit. And after that, there is no limit. You can earn even 25, 30,000, 50,000 AUD per month. Again, depends on your practice, how busy it is, how much income you're generating. And as you get along the path, maybe you'll decide to open your clinic. So then there are no numbers for that, right? So that's basically whatever you do, how much you are able to do, what procedures you do. So it's how much patient you're having. So it's all based on that factor. But this, what I've mentioned here, the take-home pay is is uh, can be considered almost 80 to 90% accurate because, like I said, I know a lot of people, a lot of dentists, a lot of practitioners, practice owners, employers. So this is something that you can expect as a lower mid limit as you get started to work in Australia. Okay. And then as you are 1 to 2 years, 3 years in Australia already, you can expect something like this. And then as you go along, it can be like 20,000 AUD, and then upwards from that in any direction, right? So it can go up to, like I said, 30, 40, 50. I know people making much more than that even. So it's all about your factors, the year of experience, how much more learning you're getting yourself involved into, what extra procedures you're getting, how much uh, uh, procedures or the number of days you're working. And even some people will work in different clinics as well. So it's all up to once you move and decide how your life goes on. And then there is a super component, which is 12%, right? So this is the amount that hits your bank. But if you are an employer sponsored, if you're on employer sponsored visa, you will have to subtract the 12% from these payments, right? Because 12% is basically super, which is the retirement fund. It is your money basically, but it is kept in the retirement fund, which you can only access after 60 years of age. So it's your money. It's not that it's the tax or something. Super is basically a retirement fund. So which goes into your retirement fund. So 12% is the compulsory rate in Australia for super. So for example, if you're making 10,000 AUD per month, 12% of that amount will go into your super fund. So that's your money basically, but it will be accessible for you at the time of retirement, which is 60 and above, right? And the same goes for everyone. But please remember, super is only for someone who is working under an employer, like unless they have a PR. Once you have a PR or once you're a citizen, then the 12% is not deducted from your salary. Okay. Then it's up to you. It's optional. Would you like the amount to be deducted or not? It becomes optional once you have a PR or a citizen. Before that, it's compulsory. Okay. Because once you get the PR or citizen, you don't work as an employee, right? You work as a contractor. So you offer your services to the clinic. And then you don't have to pay 12%. You still can if you want, but it's an optional. It's not a compulsory amount that needs to go to your retirement fund. And then, of course, it also depends what contract you have with the practice that you're going to work with. Either you have a contract which is some will give retainer only, which means they will give you a fixed salary. Some will give you retainer plus commission, which means a fixed salary plus a commission. All right. Now, I have this word calculation example. All right. Let's say your package is 200,000 AUD, which is a fixed salary retainer plus 40% commission. Okay. So 200,000 AUD, it's 16,666 AUD per month, right? So that's what you will get. If you're on a fixed salary or retainer only, let's say you're on this package, all right? This is your contract. So this amount is going to come to you regardless of whether you have a lot of patients or you don't have any patients. It doesn't make any difference. So this amount is going to hit your bank account. But if your 40% is greater than 16,666, you will get the greater amount for that month because your contract states also 40% commission, right? So if your 40% commission for that month is greater than 16,666, you won't get 16,666, right? You will get the greater amount. Because usually this is something that is followed in Australia. But please remember the fixed one or the retainer, which is the retainer, right? It's a fixed salary. The 40% commission is more rewarding than the retainer as you get along the journey. Okay. I remember once I moved, I was having both these package, the retainer and commission. But from the first month onwards, my commission was greater than the retainer. So the retainer was just a number in the contract because it didn't make any difference to me, right? Because my 40% commission was greater than the amount that I should be earning uh, based on my contract per month, right? So if there is a clash between the amount that you should be earning per month and the commission, then you get the higher amount, whichever is higher. Okay. So initially, please remember it's okay to be on a retainer. Once you develop your setup, your patient base, then the commission one is more rewarding. That's what I have felt, and a lot of other dentists that I know have felt as well. Okay. Living standards in Australia. Dentists in Australia enjoy a high standard of living with strong earning, good work-life balance, and professional respect. The country offers excellent healthcare, safety, and lifestyle quality, though living costs are higher in major cities like Sydney and Melbourne. So, of course, it will vary, but they're not significantly higher for you because you're earning well. So, you don't really worry about the cost of the rent and the accommodation because you are going to earn enough that the rent is not going to eat up a major chunk of your salary. Work conditions are well regulated, emphasizing ethics and continuing education, making industry Australia both financially rewarding and personally fulfilling. Now, good thing about Australia as well, there is a good work-life balance. You can always go up to your employer and tell them, you see, I can't work 5 days, let me cut down to 4 days. Or let's say you have kids that you need to look after, you can just tell them, I'll work for you 2 or 3 days. So there is a quite good of balance. And then there are so many learning opportunities. Let's say you don't know how to do Invisalign, you don't know how to do implants, or maybe you want to refurbish your skills for root canals and become more confident with them. There's so many courses running. The employer will also encourage you, please attend them. So it's a very good work-life balance. And you will really enjoy the journey here once you start working as a dentist in Australia. All right. So thank you for that. I hope this video does help you a lot and it clears a lot of questions that so many candidates have once they are done with ADC or when they're even starting the ADC. What will my life look in Australia? What I'll be earning? What are the visas options available? So please watch this video carefully. Maybe watch it again so that you have clarity. The areas where I have captured data from different websites like the Department of Home Affairs, make sure go through that, look at the options of visas are available to you and all that. It will be pretty much clear. All right. Thank you so much. Have a good day.